So when I asked people on Instagram what their goal was for this year, a lot of people actually said that they want to pass their CCRN. So I wanted to do this new series where we go over CCRN style questions and I go through my thought process of how to answer them and hopefully give y'all some information on the different kinds of questions that you might see on the CCRN. So the first one that we're going to start with is, of course, cardiac, because that is my favorite thing. And this is my favorite style question, to be honest. So this is going to be regarding STEMI locations. So this is a 62-year-old male who presents to the emergency department with crushing substernal chest pain radiating to his left arm and jaw. His ECG shows ST segment elevation in 2, 3, and AVF, with ST segment depression in 1 and AVL. His blood pressure is low, heart rate is low, 52 beats per minute, and lungs sound clear. So which coronary artery is most likely occluded and which associated complication is this patient at high risk for? So the answers that we have are the LAD with acute pulmonary edema, the left circumflex with papillary muscle rupture, the right coronary artery with right ventricular infarction, or the left main coronary artery with cardiogenic shock. So I'm not lying to you when I say this is exactly what I drew on my spare piece of paper whenever I got to the place where I was testing when they gave me this piece of paper. So this is a very poor drawing of a heart, but it represents the locations of every lead on it, as well as the major coronary arteries that we're looking at with questions like this. So the question says that we see ST segment elevation in 2, 3, and AVF. And as you can see, this is associated with the inferior portion of the heart. And then it says we have depression in AVL and 1, and that is directly across from these leads. So we know that whatever is happening, it's happening down here in the inferior portion. And the RCA is the coronary artery that will supply most of the inferior portion of the heart. So it's going to be the RCA. So if we were looking at things like ST segment elevation in V1, V2, V3, V4, we could say it was the LAD. If we were looking at AVL 1, V5, V6, maybe we can look at the left circumflex. But in this case, it's inferior, so it is going to be the RCA. And with that, we are afraid of a right ventricular infarction. Of course, we can confirm with a right-sided ECG, but with the information that we have here, we're going with RCA. Now, the bonus question is why is this patient bradycardic as well?